Hello, and thank you so much for tuning into the program. I'm your host, Neal Howard, here on Health Professional Radio. Our guest is Andy Hilew. He's a husband and a father of 5 from Detroit, Michigan, and he's joining us here on the program today to talk about his journey with advanced prostate cancer, his diagnosis, and also his immunotherapy treatment. Welcome to the program, Andy. Thanks so much for coming in.
Right. You're welcome, and I appreciate your introduction.
Tell our listeners a bit about yourself.
I'm 71 years old. I live in the Detroit area. I practice law. I'm currently working. I retired in 2005 from my private practice, and since that time, I initiated my professional involvement as general counsel for a military contractor. So at 71, I'm still working, and the reason I'm working is because it keeps me occupied and keeps my mind alert. I have, as you mentioned, I have 5 children. I'm very happily married, and I enjoy life. I enjoy activities. I'd like to consider myself an avid golfer, although my handicap is pretty high. Uh-huh. I run. I try to stay very active. I'm active in the community. And so I have what I call a robust life.
So what happened in 2009 that changed things?
I saw my general practitioner, John Byrne, associated with Beaumont Hospital, and we decided to take some blood work. And in the blood work, this is the first time that I was detected as having a high PSA. As a result of that, he suggested that I get a diagnosis of this. So I went to Beaumont Hospital, which is located in Royal Oak, Michigan, and they did an evaluation recognizing that I had a Gleason score, which was in excess of 8 at the time I was diagnosed, and that was in April of 2009. Following that, there was a recommendation that I have surgery. The question at that point was whether or not I have surgery that was done by a practitioner without robotics or look at the new Da Vinci Method. Mm-hmm. After interviewing a number of doctors, I decided to have the Da Vinci robotic surgery performed by Dr. Manny Magnon out of Henry Ford Hospital. He was supposed to be and is recognized as a leading practitioner in Da Vinci robotics. Right. This was done in November of 2009.
Now, and I definitely want to touch on that. But prior to your urologist recommending that you get this further diagnosis, what were some of the symptoms? What would someone be looking for to cause them to talk to their doctor?
I sensed that I was getting tired rapidly. Instead of being able to conduct a real active schedule, which I always had, it seemed like over a short period of time, I started getting tired and started turning in much sooner in terms of sitting down, resting, and or laying down and sleeping. So being tired, I think, is a symptom that probably was related. Also, by the way, my personal life started being affected, which I noticed as well about that same time.
So all of that prompted you to take a look and do some investigating. And like I say, you're working with your doctor to manage your treatment. And you mentioned the Da Vinci Method earlier?
Yes.
Mm-hmm. So is that the treatment that you underwent that treatment in 2009 as well?
Yes. That was in November of 2009 at Henry Ford Hospital. They have a benefactor that donated money to a cancer clinic there, and it was named the Vatakuti Cancer Clinic at Henry Ford Hospital.
So was everything pretty much back to normal after that treatment? Was it successful, at least enough to get you back into the active lifestyle that you were accustomed to?
Yes. At that time, we had follow-up, and my PSA was well under 2 at that point, okay. And it looked like it was successful. The follow-up was conferences and visits monitoring the progress of the PSA, and also some discussion on whether I should consider radiation as a follow-up or maybe a more conservative approach by just simply monitoring.
So you're watching and you're waiting. What did you finally come upon as a possible solution?
Well, after a period of time, it looked like my PSA was stabilized, so I felt comfortable that we eradicated the cancer. And frankly speaking, I did not visit a doctor until sometime later, which was in 2014. So I had a gap of probably about 3 years where I didn't see a doctor.
And you're feeling okay in those 3 years? What was the next thing that happened?
Well, the next thing that happened is, again, I started feeling very tired. More tired than so. And in that same period of time, I also had difficulty in putting in a full-time schedule at work because of the fact that I was tired. I gave up a lot of my social activities and sports during that period.
So you were familiar with these symptoms. These were the symptoms from before, except a little more severe. Were they about the same? And they just tipped you off to let you know that there was a problem again?
Honestly, at that time, I really didn't connect the two.
Okay.
Until I happened to visit at Beaumont Hospital when I decided to have a PSA done voluntarily, not by doctor's orders, but I saw a doctor there that was treating a relative of mine, and I suggested that I haven't had a PSA, can we check it? Which he was kind to do.
So is that when you found that your cancer had spread and immunotherapy was offered as an option, or had you heard of immunotherapy before this?
No, I didn't know anything about the nature of treatments, but at that time, my PSA was near 80.
Wow.
And
off the charts.
Off the charts. And this was evidenced by a CT scan that followed up in terms of determining that I had a tumor in exactly the same spot that I had the prostate. Obviously, it grew in exactly the same spot that the prostate would have existed. And I started radiation treatments in about June of 2014 with Dr. Dan Kraus of Beaumont Hospital, who's a specialist in this, and continued. I think I had some 33 treatments that extended through the beginning of 2015.
Oh.
So this would have been late 2014 and into 2015.
So how are things now based on the therapy, and are you still undergoing this therapy?
Well, I had radiation, and as I said, which extended, and I also initiated with the outpatient treatment, which was handled by Dr. J. Hollander. And at that time, he administered Lupron and also a hormone therapy, which I started taking. And that Lupron was used every 3 months, where I would go in and I would take a hormone shot and also Lupron. And this was injected by Dr. Hollander. Approximately May of 2016, Dr. Hollander recognized that my PSA started climbing again. And at that time, he referred me to his colleague, Dr. Jason Hafron, who undertook care for me and is still my treating physician.
Mm-hmm.
At that time, it was determined also that I probably had a castrate-resistant tumor, and my PSA was climbing. And so Dr. Hafron then initiated a treatment with a number of drugs. He suggested that I start with Zytiga. He also suggested that prednisone. He also continued with Lupron treatments until approximately August of 2016. In the meantime, he also referred me and suggested that I take Provenge, which was the immunotherapy. And at that time, my PSA was somewhere around 4.6, 4.8, almost 5.
It had dropped considerably.
So, right, that's when I started with Provenge.
Mm-hmm. How are you doing today based on that cocktail of these drugs? And what advice do you have for others faced with prostate cancer diagnosis, especially if they find that it's in an advanced stage such as yours?
Right. I did want to tell you that the Provenge caused my PSA to drop down to from 4.8 to around 1, which I thought was good.
Phenomenal.
He also switched me from Lupron to Exgiva, which is also treatment that I'm undergoing. So currently I have Exgiva, Zytiga, Prostate, which is for your bones, and I monitor this closely.
Right.
What would I recommend?
Mm-hmm.
I would recommend that whoever is listening to me, don't be afraid. Stand up to it and visit your doctor as often as possible, at least every year, to make sure that your PSA is under control and you don't have to go through the same experience I did when it was caught at the point when I had a PSA of over 80. That's what I would recommend.
Well, I appreciate you coming in. I appreciate your story as well. Andy Hilew, a practicing lawyer, shocked when he was diagnosed with prostate cancer back in 2009. It's been a pleasure talking with you, and I'm looking forward to some more conversations with you.
Anytime. If I can help anybody, I will.
Thanks. You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of the program are available at healthprofessionalradio.com.au and also at hpr.fm. Subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page when you visit us at hpr.fm and healthprofessionalradio.com.au.